Are you having neck, upper back, and arm pain? We've got 3 exercises that we're going to show you that in less than 1 week should either reduce or abolish your symptoms. Let's get started right now. So typically, if these exercises are going to help you, you have some loss of motion at the cervical spine, this area here. Not always, sometimes it's not really apparent, so I want you to do these 3 motions to assess whether you have loss of motion first. You need a little friend just to take a video of you or a still photo so you know where you're at and also if there's a change after doing these exercises. So the first motion, the first movement is a chin retraction, okay? So we want to sit up nice and tall. We're going to do this from a side view like this. We want ears of the tip of the shoulder if you can, okay, or at least here. Chest out, okay, so there's no movement through here. You want to pull your chin straight back like you're on a railroad track. So straight back, retract, like that. You should get almost a complete flattening of the neck here as you go back. This one is the hardest one to tell if you have loss of motion because sometimes even it's a ½ inch, it could mean it's something that you can work on. Next one is a chin retraction with extension, okay? So the way we check this one, if we do the first part, retract, and then we relax, we try and look up to the ceiling. Make sure we're not moving our body here. We gotta keep this nice and upright. Retract, and look up to the ceiling. For most people, we want the chin and the forehead to be level, okay? All right, level with the ceiling or the floor. So retract and look up, and let's see how far you go. Take a shot of that, the retraction before, and this one, see where you end up, okay? The last one, which is pretty easy, is we want to be able to turn, like I said, nice and upright, sit up nice and tall. You can do this in standing, but it's easier in sitting. And you want to bring your chin over and almost over your shoulder, okay? Most people can't get over their shoulder, but we want to get pretty close. But make sure you're nice and upright all the way to here, right, and all the way to here, left. This one you could do with a photo, or you can just kind of visualize, see, okay, I'm about here, okay? So keep those 3 on file, and then after you do the exercise that we show you, we want to see if there's a change in motion. Sometimes it happens the first time you do these stretches. Sometimes it takes about 3 to 5 days before we notice a difference, upwards of a week, okay? So that's, just keep that as your log, and you can actually take pictures every day to see if there's a change in motion, especially if you're really tight. Okay, so these exercises that we're giving you, like I said, if you have neck, this is good for neck, upper trap, shoulder, upper back pain, arm pain, sometimes even hand pain. These might be something that will help you, okay? Sometimes you don't even have neck pain, you're just gonna have arm pain. I would try these anyway. So the general rule of thumb is I'll tell people to do these movements, and I like to generally pick one at a time. I generally not like to have you do all 3. Sometimes it's not clear which one is helping you. So start with one and then try it a few days, and then you can always go on to the next 2 or 3. Okay, so it's good. So what you're gonna do is you're gonna do this movement, the stretches 10 times every 2 hours. So we're gonna get about 5 sessions in a day. What we're hoping to see is a trend after about a week. If there's an improvement, no change or worse. If it's clearly getting worse very rapidly, stop it immediately, okay? You may need an evaluation from a therapist or a physician. If you're clearly seeing a change or it's neutral, it's not improving, or it's slowly improving, keep on doing it over the course of the week. Sometimes you have to do this, especially if you've had something for a very long time. You need more time to push on it, or you have a great deal of loss of motion. You really need to kind of affect those tissues, and it takes longer to have a change. But typically within a week, we all know whether this is a good or bad exercise or neutral. Okay, so keep that in mind when you're doing these. So our first one is a cervical retraction. It's probably the hardest one to do because most people feel like they're not moving that far when they're doing it. Okay, so it is very subtle. Okay, first thing is you want to sit up as tall as you can when you do this one. Chest out. Let's say this is your starting point right here. You're about here. Okay, you're going to retract back and release. You can do it with just moving your head, or you can add a little pressure with your 2 fingers. Not a lot, just a little bit. So pressure on, pressure off, pressure on, pressure off. So you're only holding for 1 or 2 seconds at the end of the motion. So you got to feel like, I can't go any further, Tom. And then slowly, as you do more, we want to feel like it loosens up. To the point where you're getting a flattening from here by doing the cervical retraction. This is probably the first exercise I give most people. It's a good starting point. Like I said, 10 times every 2 hours, about 5 sessions a day. Okay, so that's your starter. The second one is a cervical retraction with extension. Okay, so this one is just simply same one. We're just doing the first part and we're adding a second part. So we're retraction like this, and then we're relaxing it and letting our head fall back as far as we can. And this makes a lot of people nervous. People don't want to look up, but it's a very natural position. Your neck's supposed to be able to do this. You're going to go back as far as you can, and sometimes we'll add a little bit of a wiggle at the top. So if I show you from a front view, there's a little wiggle like that, and then back down. So retraction, go as flat as you can, then let your head go back as far as you can, little wiggle. If you can't do the wiggle or it bothers you, some people can't tolerate it, just go back as far as you can, but you got to get to the point where you feel like, I can't move it any further. When people have trouble with this exercise, most times it's because they're leaning forward a lot, and they do it from here, and they block their motion. Just because their upper back, their upper chest is not in the right posture and position to start the exercise. General recommendation is 10. If you're nervous, do 3 to 5. It should never make your condition worse. If it's not making an improvement initially, that's okay. It may take longer, but realize it should never make it worse. So this last one is called prone retraction with extension. This one actually stretches the upper back a little bit more. It's a little bit more of an intense stretch, so some people do great with the stretch. Some people feel like they just can't get the motion. We're going to show you, because when it works great. Set up in a slightly forward position, just like I'm standing, but we're going to keep our chin down. We're going to do the retraction first. Retraction, like this. And then we're going to roll our head back as far as we can. And we're going to try that little wiggle. Okay, so remember the first part, retraction. Right up, little wiggle. To increase the intensity a little bit, we'll add a little bit of pressure with this one. This one's a little awkward, so you gotta do the retraction. See, I'm getting good flattening here, which is probably the biggest mistake. People do this and not this, and then look up and do a little wiggle, but instead, we add a little pressure through our fingers, under our chin, okay? Up, and a little wiggle like that. So again, retraction, roll up, put the fingers up, little wiggle right here. If you're not getting to the end of the motion, it's probably not going to be as effective. Okay, so keep that in mind when you do this. I would start with the first 2 before you get into this one. Don't start with this one. This one is more the third prior to, if you feel like the first 2 you weren't getting an improvement. So the first thing we want to see when we're doing these exercises, like I said, it could happen the first session or a few in, is we want to see an improvement in range of motion. So we want to see one of the directions there is an improvement in range of motion, even if there isn't a change in your pain levels. The second one, sometimes people will actually have some weakness. They'll actually feel like they can't lift the arm as well, or they can't move they have some kind of like weakness associated with this. Sometimes it's shoulder weakness. They think it's a rotator cuff tear problem. They actually notice that they have improved ability to raise the arm or reach for a cup of coffee, and that changes in addition to the neck, upper back, and arm pain. The third, we want to see about the movement of pain. So the movement of pain means there's this phenomenon called centralization and peripheralization, just fancy words. So first want to start, where is the pain located? Let's say it's located just in our shoulder right here, and it's a little bit in our upper trap area or neck. With centralization, we want to see the pain move out of that area. So when you start doing these exercises, if you notice the pain is moving up, let's say it started in the shoulder and upper trap, after doing a few retractions, it moves out of the shoulder, and now it's just up in the upper trap. That's a sign you can keep on doing that exercise. Now it's out of the upper trap, it's moving to the neck, still good. Keep on doing that exercise. Another scenario too is if it's in the shoulder, even if it just decreases in pain, that's considered an improvement or partial centralization. We're in the right direction. Let's do more of that exercise, even if you're in pain. And all these exercises you can do when you're actually having pain. Some people say, well, I can't do it unless because I was having some pain. No, you can do these stretches. They're meant to reduce the pain or abolish it. So keep that in mind. Now, peripheralization is a bad direction. Okay, so let's say we have just neck pain. We do one of the stretches I give you, and we actually see the pain now moving out of the neck. Now it's into the trap. It's into the upper arm here, elbow, wrong direction. That means that it's not the right exercise or you're not doing it correctly. It's one of those two things you want to stop, okay? So that's very, very important. So we're gonna look at those 3 areas when we're doing these exercises. For the range of motion, you can do before and after photos or pics are really helpful, or you'll just get a sense it feels looser and I have an improvement in motion. Sometimes it's not even you have more motion, it's that the motion you have is more comfortable. That's a good sign too, so keep that in mind. So all these stretches are meant to improve neck mobility. If it's not mobility, meaning you have very good, let's say you check your range of motion and say, Tom, I have great mobility, you can still try it. Sometimes, someone's very hypermobile. It doesn't look like they have a loss of motion, but they still need to do these stretches. In other cases, doing stretching or range of motion is not the solution to your problem. So you may need to do maybe some strengthening exercises. It could be neck issues can be related to something you're doing ergonomically. It can be related to stress. So, consider that could be some of the other problems. Also, there's other stretches that we give in the clinic depending on how the evaluation went. We're just showing you a brief kind of look that we're going to try and do at home. But realize sometimes we have to go work into forward flexion. Sometimes we do an exercise called a protraction, okay? Sometimes we'll do a rotational stretch or side bend. It's really based upon the response and how you respond to the movements. I'm just showing you a few that are more common that we give in the clinic, all right? At the end of the day, it's great to get a good evaluation by a physical therapist to find out the one that's gonna get you better the fastest. But if you wanna try these, as long as you understand the rules on what's good and bad pain and improvements, I hope you do well and take care of yourself if you can. Have a great day. Like, subscribe, send a quick comment. I'll respond to as many as I can, all right? Have a great one.